Hey everyone, welcome to my channel. In this video, we talk about 11 thyroid symptoms you need to know, and don't forget to subscribe and like and turn on the notification button. Signs of thyroid problems vary depending on the cause. An overactive thyroid could make you sensitive to heat, cause weight loss, and lead to diarrhea. An underactive thyroid, on the other hand, could have you feeling sensitive to cold, gaining weight, and experiencing constipation. Any of these and other thyroid symptoms could also be early warning signs of thyroid disease. Here's how you may feel when you have thyroid problems and what to know about some of the most common symptoms of thyroid diseases. Thyroid problems. Your thyroid, a small gland in your neck shaped like a butterfly, greatly impacts your body. It produces thyroid hormone, TH, which is responsible for keeping your metabolism, heartbeat, and more in check. There are a few health conditions that are associated with the thyroid. These can include goiter, an enlargement of the thyroid gland; hyperthyroidism, an overactive thyroid that makes too much TH; hypothyroidism, an underactive thyroid that doesn't make enough TH; thyroid cancer; thyroid nodules; thyroiditis, swelling of the thyroid. What causes thyroid disease? Thyroid symptoms. TH controls many aspects of the human body. Therefore, thyroid diseases cause several different symptoms. Find out if any symptoms you are experiencing may be related to thyroid disease. Remember that just because one of the following symptoms links to a thyroid disease does not mean you have a thyroid disease. In any case, it's best to consult a healthcare provider for a proper diagnosis. 1. Brain fog. Sure, it could be caused by sleep deprivation or aging, but cognitive functioning can decline when your thyroid is out of whack. 2. Brain fog can indicate hypothyroidism. It may cause symptoms like difficulty focusing, forgetfulness, low energy, sleepiness. Brain fog symptoms can even persist after your TH levels are stable at normal levels. 18 causes of brain fog. 2. Changes in appetite, digestion, and weight. TH is one factor influencing appetite, and hyperthyroidism can increase your appetite. So, even though hyperthyroidism is typically associated with weight loss, you may gain weight due to increased appetite. Still, appetite-related symptoms are not the same for everyone. For example, adults over 60 years old may lose their appetite instead of increasing it. Your thyroid is closely connected to digestion. An overactive thyroid gland can cause frequent bowel movements or diarrhea. 4. In contrast, an underactive thyroid can lead to constipation. When something disrupts the production of TH, that may cause your digestive processes to slow. Like with appetite, TH can also regulate metabolism. So, weight gain and weight loss are common thyroid disease symptoms. Hypothyroidism typically causes weight gain. People tend to put on more weight when the thyroid is underactive because their metabolism is lower. However, extreme weight gain is rare in hypothyroidism. In contrast, hyperthyroidism usually causes weight loss. This is because your metabolism is working at a high rate when your thyroid is overactive. The severity of weight loss relates to the severity of hyperthyroidism. If your thyroid is only slightly overactive, you likely won't see as much weight loss as you would if it were extremely overactive. 3. Cold and heat tolerance. How your thyroid gland is functioning affects how you perceive temperature. One of the symptoms of hypothyroidism is trouble tolerating the cold. 5. When an underactive thyroid slows down body systems, your cells may have less energy to burn. Less energy means less heat. On the other end of the spectrum, an overactive thyroid puts energy-producing cells into overdrive. So, people with hyperthyroidism may have trouble tolerating heat. 4. Difficulty sleeping. Sleep disorders related to thyroid symptoms include insomnia, restless leg syndrome, and obstructive sleep apnea. A thyroid disorder that's not treated can make these sleep problems worse. 6. Here's how a thyroid that is not functioning properly is related to these common sleep problems. 6. Insomnia. High levels of TH can give you problems falling asleep or staying asleep. Hyperthyroidism can also make conditions like anxiety and depression worse, which can also impact your sleep. Hypothyroidism isn't directly related to insomnia, but could affect your sleep quality by making other conditions worse. Being uncomfortable from severe muscle and joint pain caused by an underactive thyroid could make it difficult for you to get quality sleep. Obstructive sleep apnea. Many people with obstructive sleep apnea also have hypothyroidism, but how exactly these two conditions are related remains elusive. Restless legs syndrome. Hyperthyroidism and hypothyroidism can both contribute to restless legs syndrome. Treating thyroid hormone levels may provide symptom relief. 5. Dry skin or hair. Thyroid disease can cause several problems with your skin, nails, and hair. Skin and nail symptoms may include 7. Brittle, dry, thick nails with ridges. Changes in how quickly nails grow. Curved swollen fingertip and thickening above the nail. Deep lines on your palms and soles. Discolored skin. Dry, pale, or itchy skin. Nails that peel, crumble, or break easily. Protruding eyes. Rashes, especially in skin creases. Soft, shiny nails. Slow healing wounds. Sweating less or more than before. Widening nose. You also have a high risk of developing thyroid disease if you have skin conditions like vitiligo, hives, or alopecia areata. Thyroid disease can affect the growth and texture of your hair. Hair symptoms may include coarse, dull, dry, and brittle hair that breaks off easily. Changes in growth rate. Hair loss and bald patches. Itchy, dry scalp, and dandruff. Less hair in places like your arms and legs. Soft and fine hair that sheds a lot. Thinning or missing hair on outer edge of your eyebrow. If you're shedding more than usual, don't freak out. Hair loss can happen for a variety of other reasons, like childbirth or overuse of hair products. See a healthcare provider to get help determining the cause. 6. Fatigue. Your thyroid is involved in numerous body functions from breathing and heart rate to weight, digestion, and moods. 1. When it's out of whack, it's no wonder that you may be feeling extra tired or have a lack of energy. Fatigue can be both a symptom of hypothyroidism and hyperthyroidism. It can affect you mentally and physically. If you're still tired in the morning or all day after a full night's sleep, that's a clue that your thyroid may be underactive or overactive. Fatigue. Everything you need to know. 7. Heart problems. Heart palpitations can feel like your heart is fluttering, skipping a beat or two, or beating too hard or quickly. You may notice those feelings in your chest or at pulse points in your throat or neck. TH plays a role in heart function. For example, heart palpitations can signify too much TH flooding your system. Between 10% to 25% of people with hyperthyroidism have a rapid heartbeat. Hypothyroidism can also cause different effects on the heart. With hypothyroidism, you may experience symptoms such as constricted blood vessels. Fluid retention causes swelling. High blood pressure. High cholesterol levels. Slow heart rate. Heart failure may occur if those symptoms are left untreated. 8. Lump in your throat. A change in your voice or a lump in your throat could signify a thyroid disorder. A thyroid nodule is a lump that grows in the thyroid gland. Many thyroid nodules are benign, non-cancerous, but some can be malignant, cancerous. Your thyroid can also get so big your neck may look swollen. This enlarged thyroid is called a goiter. A goiter can be a sign of either hyperthyroidism or hypothyroidism. A lump in your throat could be due to other thyroid disorders as well. Thyroid cancer can cause a lump, but you may also notice difficulties breathing and swallowing, pain when swallowing, hoarseness, or other voice changes that don't go away. Swelling or inflammation of the thyroid gland can also be a sign of thyroiditis. Hashimoto's disease, a form of thyroiditis, is an extremely common cause of hypothyroidism. Thyroiditis can also occur after the delivery of a baby. This type is called postpartum thyroiditis. 9. Mood changes. As your levels of TH change, your mood can change too. People with an overactive thyroid may experience nervousness, irritability, and mood swings. People with an underactive thyroid seem to have a higher chance of developing symptoms of depression and anxiety. If you're taking medication for depression, make sure the healthcare provider who prescribed the medication knows about your hypothyroidism. Tricyclic antidepressants used to treat depression are not great for people with hypothyroidism. 10. Muscle changes. Sometimes you work out too hard and your muscles feel sore afterward. However, mysterious or sudden muscle changes can signify thyroid disease. When your thyroid is in hyperdrive, hyperthyroidism can cause muscle weakness. Too much TH in your system can also lead to myalgias, muscle tenderness, and wasting of the muscles in your shoulder or pelvic girdle, where your pelvis meets your legs. If your thyroid isn't working enough, you may have pain in your muscles or joints. 5. About 80% of people with hypothyroidism experience hypothyroid myopathy, which is muscle pain or weakness. If untreated, the muscles can become severely affected, which may cause limited mobility. It isn't very clear why thyroid disease causes problems with muscles. Some evidence suggests that a deficiency in TH can impair the cell's function, leading to muscle pain and weakness. 11. Reproductive system changes. Thyroid dysfunction can have various effects on different parts of the reproductive system and vice versa. People who have completed pregnancy or menopause may be more likely to develop thyroid disease than others. Irregular periods. Your thyroid plays a role in the menstrual cycle. If your thyroid makes too much or too little TH, that can throw off your menstrual cycle. For example, you may have light, heavy, or irregular periods. Thyroid disease can also cause amenorrhea, when your periods stop for several months or more. You may also go into menopause early, before age 40 years, if you have thyroid disease. Any protrusions or bulges you find will need to be evaluated by a healthcare provider so they can be treated properly. That's it for today's video. If you enjoyed this content, don't forget to like and subscribe to our channel for more fascinating insights. Be sure to hit the bell icon to stay updated with our latest videos. We also encourage you to leave a comment below, sharing your thoughts and suggestions for future topics. Thanks for watching.